Guys, in this video, let us look at the upper limb previous year questions, anatomy. So in this question, they have asked features and structures attached to clavicle. In this video, let us look at the structures attached to clavicle. You should be able to write this for around 2.5 marks because total question is asked for 5 marks. So the features for 2.5 marks, let us say, and structures attached for 2.5 marks, or if they have some other way of division, maybe they will give 2 for features and 3 for structures attached. Okay. So structures attached to clavicle. First of all, features we have already covered in previous video. You can let's take a recap of that just in case. See, clavicle, right? There are parts that you need to know are shaft, lateral end and medial end. That's all you have to know. Okay. So shaft, where is shaft? This long thing is shaft. Okay. So this is the shaft. Let me use a better color. Hold on. So this is the shaft. So how do you draw clavicle? Like this? Okay. The right side. So what you have here? Lateral 1/3 like this, right? Lateral 1/3 and medial 2/3 you have, right? Lateral 1/3, right? And the inferior aspect, it has a trapezoid ridge and a conoid tubercle. I'll show you that. So here in the inferior aspect of the lateral 1/3 of the shaft of clavicle, here you have the trapezoid ridge and the conoid tubercle. Okay. Then these are the features you should know. And then medial 2/3 you have the subclavian groove in the inferior aspect. So let's look at that here. So medial, this is medial 2/3, right? Inferior aspect, here you have the subclavian groove where the subclavian muscle seems to be attached. Okay. Then coming to the lateral end, also called as acromial end, the acromial end will articulate with the acromion process of the scapula to form the acromioclavicular joint. Okay. So I'm hoping that you have noticed that here. Even this diagram has that. So you have the acromion from the scapula. Here you have the acromioclavicular joint. Okay. So this is the lateral end. Now coming to the medial end. Medial end is also called as what? Sternal end. It is quadrangular and it will articulate with the manubrium sterni, right? And it will form the what? Sternoclavicular joint. Okay. And then this first rib is there, right? The first rib also it will articulate. The inferior aspect of this medial end is there, right? Here somewhere it will articulate with the costal cartilage of the first rib. So it will articulate with the first costal cartilage. Okay. So where can you see that? Maybe in this diagram. So here you can see that there is a sternoclavicular joint in the medial aspect, sternoclavicular joint, and here you can see it is also articulating with the first costal cartilage of the first costal cartilage. That's all. Okay. Not with the first rib. That's what you have to remember. So these are the features of clavicle that we covered. Now let us look at the attachments of clavicle. Okay, so this is what we had to cover for this actual video. So what and all can be attached to a bone? Ligaments, muscles, right? So in the lateral end, that is, give me a color here, better one. So here the lateral end, what do you think is attached? Yeah, so you mentioned same thing, okay? Acromioclavicular joint. Acromioclavicular joint is there. So here at the lateral end, the margin of the articular surface gives attachment to the joint capsule. Okay, so let me write that here. Next, coming to medial end, what and all you have already seen. Sternoclavicular joint. Then it will also articulate with the first costal cartilage. Here they are saying that there is some articular disc posterior-superiorly. So articular disc is there and interclavicular ligament is there. They are saying here in the medial end. Okay, but not going into details of that. Now coming to lateral 1/3 of shaft, what and all attachments are there? So lateral 1/3, what can you see here? Attachments here. Lateral 1/3, what attachments can you see? Anterior border will give origin to deltoid. So I wouldn't remember so much, but if you want, you can remember. Deltoid is something that I can see, right? Then anteriorly deltoid I can see. Posteriorly it is trapezius. Okay, this one. Posteriorly it is trapezius, right? Trapezius muscle. Okay, then you have already seen in lateral 1/3 of shaft, what you have already seen, say, you have seen that ligaments which attach to what? The trapezoid ridge and conoid tubercle, right? So you have a ligament which attaches to trapezoid ridge, and similarly you have a ligament attached to the conoid tubercle. Okay, that's all about the lateral 1/3 of shaft. Is it becoming too much, guys? Just let me explain again. So here you have the clavicle, right? This is how I would draw one nice clavicle. Okay, so this is the lateral 1/3, right? Here you had seen that below there is a trapezoid ridge and a conoid tubercle. So there some ligaments are attached. What is that? Ligament, that is trapezoid ridge, right? Then ligament to this conoid tubercle. Sorry, focus. Then muscles. Anteriorly, what did you see? Deltoid, and posteriorly you saw trapezius. Okay, muscle. Okay, so lateral 1/3 is done. Lateral 1/3 of shaft is done. Now let us go to medial 2/3 of shaft. Okay. Now medial 2/3 of shaft, what do you see? Medial 2/3 of shaft. Medial 2/3 of shaft is here. So definitely some portion of deltoid I am seeing. Okay. And what is this? This is looks like pectoralis major, and this looks like what? Sternocleidomastoid. Okay. So that and all we'll write here. So pectoralis major, sternocleidomastoid, right? Then mainly these two you remember. Inferiorly pectoralis major, and then superior surface sternocleidomastoid. Then you remember we have already looked at subclavius muscle in the in this previous one, in this diagram. We saw this, right? The medial 2/3 of the shaft has a subclavian groove where the subclavius muscle is attached. Okay, so I'm just trying to tell you this. Then so we have added here subclavius muscle. Then what else? There are some things that they are saying, like some costoclavicular ligament. Right here, some costoclavicular ligament is there. Okay, some ligaments you add here and there. Then sternohyoid muscle. Now sternohyoid muscle, I think, where is that image here? Here. So sternohyoid muscle, see this one, it is attached here to the sternum actually, right? So from the hyoid to the sternum, but they are saying some portion of it is there attached to the clavicle also. Okay, so let's not forget him. So we will put sternohyoid muscle. Okay. Is this okay? Now let us go to the last part here, inferior surface of clavicle. So why this inferior surface of clavicle is there? Because in the inferior of surface of clavicle, some things are there. Okay, here, inferior surface of clavicle, they didn't say which part. Entire clavicle, subclavian vessels and brachial plexus are there. Okay. What is there here? Subclavian vessels and brachial plexus. Okay. So some nerve plexus, artery, veins, all that are there. Okay. Inferior surface of clavicle. So you can see here, this is a clavicle. Below it, you can see here subclavian artery, subclavian vein, and brachial plexus. Okay. So inferior surface of clavicle also. This is more like a relation. I wouldn't say it's an attachment, but the textbook says that it is there. So under attachments, they've written this. So we'll also get this. Okay. So can you now tell me the attachments of clavicle? So let's come to our own revision. Let us say attachments of clavicle. So attachments of clavicle. So let us say what and all is there here. This side you have the acromioclavicular joint, and here you have the sternoclavicular joint with also it is articulating with the first costal cartilage, and you have some ligament also here you can mention. Now coming to the lateral 1/3, what and all you saw here, you saw the deltoid, and above you saw the trapezius, and then below you saw two ligaments, the trapezoid tubercle is it, and conoid tubercle, two ligaments were there, right? And here coming to the medial 2/3, what and all you saw as muscles, you saw pectoralis major, above you saw the sternocleidomastoid, then some little portion of the sternohyoid, right? And then some ligaments. We saw costoclavicular ligament. Then we saw the subclavian muscle also, right? Subclavian muscle. Let us say it is SUB, subclavian muscle. So all these are attachments. And then inferiorly of this clavicle, you saw some veins, subclavian vessels, right? And then you also saw that there are brachial plexus. It's not an attachment exactly, but they have mentioned. So let us just see if we covered everything. Lateral end acromioclavicular joint, medial sternocleido joint. What is this? First costal cartilage. Then lateral 1/3, we saw that there is ligament to the ridge. I keep forgetting that ridge name. What is that ridge name? Trapezoid ridge. Okay. And then ligament to the conoid tubercle. Deltoid you can see anteriorly. Trapezius we saw. Where is that image? Yeah. Superiorly trapezius is there, right? And then medial 2/3, pectoralis major, sternocleidomastoid, subclavian muscle, some costoclavicular ligament, sternohyoid muscle. Then inferiorly you have the subclavian vessels and brachial plexus. Okay. That's all for now. Hope you have learned 5-mark question. Bye bye.